Welcome back. In this video, we are going to discuss about the management of wounds. The first step in managing the wound is cleaning it. Wound cleaning is required to optimize a healthy environment near the wound. How do you achieve this? By removing the visible devitalized tissues, the dead tissues, and also any dressing material or the excess exudate and the crust which is formed in the healing wound. Okay, the scab and the crust have to be removed. This dressing material should be removed and the wound should be cleaned. What do you use to clean the wound? You have to take an absolute aseptic technique to clean the wound, and the ideal one is a normal saline which is warm, sterile and isotonic. The normal exudates in the wound should also be removed like we discussed previously. Gentle cleaning of the wound is required to minimize the interference of the wound healing process. Why do we clean the wound? It is to prevent it from interfering with the wound healing process. You have to clean the wound because the exudate, the crust, the devitalized tissues, all these can interfere in the healing process. They can stop the healing process. So we have to clean the wound. Cleaning agent should be neutral pH. So you are taking a cleaning agent which is normal saline. It should have a neutral pH. It should be non-toxic. Delipidizing agents, antiseptics, alkaline soaps should be avoided. The antiseptics can damage the skin, and whereas the alkaline soaps can also damage the delicate skin which is regrowing around the wound. So we have to avoid the delipidizing agents, antiseptics and alkaline soaps. And the gentle irrigation of a warm saline using a sterile syringe. So you're taking a sterile syringe here and you're giving a irrigation of the warm saline around the wound surface. It is an ideal thing. Rubbing with an undue force, okay, forcefully you're rubbing the wound with the help of a cotton or a gauze. It can cause a mechanical damage in the process of wound healing. You getting it? So you have to do the process very gently. You just remove the devitalized crust and the dressing material. This is what the step is required in cleaning process. Wound is measured either in the two dimensions. You can measure the wound either in lengthwise or widthwise. In 3 dimensions, length, width and the depth of the wound can also be measured. Now we move on to the specific management. Wound is inspected and classified as per the type of wound which we discussed in the previous video. The various types of wounds. You have to classify the wound under which category it falls. If it is in the vital area, then the airway should be maintained. Bleeding, if it is present, should be controlled. See, if it is in vital area, it's a serious wound, so you have to maintain the airway. The bleeding should be controlled to prevent the hypovolemic shock. Then intravenous fluid should be started, oxygen if required should be given, and deep communicating injuries and the fractures, the underlying fractures, since the vital area has been damaged here, you have to look for the underlying fractures and injuries if it has taken place or not. If it is an incised wound, then the primary suturing is done after a thorough cleaning. So using a normal saline, thorough cleaning should be done. Then a primary suturing is enough for the incised wound. If it is a lacerated wound, then the wound is excised. See guys, if it is lacerated, okay. So in clean cut, we just have like this, we suture it. We clean and suture it. Whereas in lacerated wound, irregular surfaces, you have to excise the irregular thing and then you have to give a primary suturing. If it is a crushed or devitalized wound, then there will be edema and also tension in the wound. Okay. So after the wound debridement or the wound excision, after removing the debridement or the devitalized tissue, by excising the devitalized tissue, the edema is allowed to subside for 2 to 6 days. We saw this in delayed primary suturing. What did we do? We allowed the edema, the tension to come down so that the suturing is proper and the healing can take place in a systematic and the sequence. Then the delayed primary suturing is done. Like I told you, we had read in the different type of sutures in the previous videos. You can check it in the playlist. So here they are saying if it is a crushed or devitalized wound, we have to wait for the edema and the tension to come down, leave it for around 2 to 6 days, and then a delayed primary suturing is done. If it is a devitalized wound, after the wound debridement, it is allowed to granulate completely. Here it is affecting very deeply the deeper tissue, so you have to allow them to granulate completely. Later, if the wound is small, the secondary suturing is done. So guys, if the wound is large, we require a split skin graft. So you can see this is the affected arm. Now they are taking a split skin graft from the right lateral thigh of a person. From the thigh they are taking the skin graft and attaching it to the arm so that they can cover the wound. In a wound with a tension, fasciotomy is done as to prevent the development of compartment syndrome. So guys, fasciotomy is a procedure in which the fascia is cut to relieve the pressure in the muscle compartment. You can see the compartment syndrome here. There is a necrosis of the soft tissues. Also, there is much muscle swelling. So what you're doing, you're giving 2 long incisions on the tibia. So adjacent to the tibias, both the sides, you're giving 2 long incisions, and this will relieve the pressure in the muscle compartment. This is used to treat the people with acute or chronic compartment syndrome. The fascia is incised. Okay, you're incising the fascia, and then the deep posterior compartment is inside, resulting in the reduced tension. Vascular or nerve injuries. Vessels are sutured with the 6-0 polypropylene non-absorbable suture material. You can see the polypropylene or proline. If the nerves are having clean cut wound, it can be sutured primarily with polypropylene 6-0 or 7-0 suture material. So you have to remember the suture numbers, suture material numbers. If there are vessels, we have to take 6-0 polypropylene and it's non-absorbable suture. If the nerves are having clean cut, then you can take 6-0 or 7-0 suture material. If there is a difficulty in identifying the nerve ends, or if there are crushed cut ends of the nerves, then the marker stitches are first placed using a silk at the site, and later you have to do the secondary repair of the nerve. First place the silk marker stitches using the silk, and then later the secondary repair. Internal injuries, the intracranial by craniotomy, intrathoracic by intercostal tube drainage, intra-abdominal by laparotomy has to be dealt accordingly. So we spoke about the silk sutures. These silk sutures will give strength and smoothen the surface. It will provide an easy passage to the tissues. Then you can give a good secondary repair. Fractured bone is also identified and properly dealt. Antibiotics, fluid and electrolyte balance, then blood transfusion, tetanus toxide 0.5 ml intramuscular IM to deltoid muscle or anti-tetanus globulin ATG injection should be given. So they are talking about the treatment here. You have to give the antibiotics, fluid electrolytes, blood transfusion if required. If there is lacerated avulsion, compartment syndromes and all that, if there is sufficient amount of blood loss and the patient requires blood, you have to do the blood transfusion. Then give them a tetanus toxide 0.5 ml IM to the deltoid muscle obviously, and anti-tetanus globulin injection. The principles of wound suturing. Primary suturing should not be done if there is edema or infection, devitalized tissues and hematoma. So what we have to do, if there is edema, devitalized tissues and infection, you have to wait for the edema and the tension to come down. Later you have to do the suturing. Delayed primary suturing should be done. Always associated injuries to the deeper structures like the vessels, nerves or tendons should be looked for before the closure of the wound, not superficially. If a person has come with a RTA, you have to check if there is any fracture or not, just not the superficial covering the wound. You have to check if there are fractures, if the damage to the blood vessels, nerves have occurred. Wound should be widened by extending the incision whenever needed to have a proper evaluation of the deeper structures. Proper exploration should be done. The proper cleaning, asepsis, wound excision and debridement. Any foreign body in the wound should also be removed to prevent the infection sepsis. Skin closure if it is possible without any tension. Skin cover by graft or a flap, immediate or delayed. You have to see how it is required and carry on the procedure. Untidy wound should be made tidy and clean before the suturing. So cleaning should be done. Proper aseptic precautions should be undertaken. Antibiotics, analgesics are needed for the pain. You have to give the required antibiotics and also the analgesics. Sutured wound should be inspected in the 48 hours to see if there is any problem. Sutures are removed after the 7 days. So there are some points to remember. Wound toilet is washing the wound thoroughly using a normal saline. The toileting of the wound is nothing but washing it with normal saline. Wound debridement, French letting loose. What is wound debridement? It is allowing the contents to come out by release incisions or fasciotomies. So I told you about fasciotomy. The same thing, they are giving a cut to relieve the pressure in the muscles. But commonly debridement is used for the wound excision. Wound excision is actually the correct terminology for the excision of the devitalized tissues once or serially. Radical wound excision is pseudotumor approach in excising the entire devitalized tissue. They are leaving the tissues with a visible bleeding from all the layers. So guys, they're talking about few points here which you have to remember. Wound toileting, what you're doing, thoroughly washing with a normal saline. Then they spoke about wound debridement and also about the fasciotomies. You're going to allow the tension to come down and then only you're going to suture. Wound excision is a correct terminology which we use for the excision of the devitalized tissue. And they're talking about the radical wound incision, in which the entire devitalized tissues you're excising, leaving the visible bleeding from the ears. So guys, you're leaving the tissues with a visible bleeding from all the layers. Moving on. Okay, so we are done with this topic. I hope everything is clear. If you have any doubts, please put it in the comment section, and if you like my video, hit the like button and subscribe.